So our next speakers are Keri Finlay and McKenzie. It's great having both Keri and Anne with us today. And the title of their abstract is Involve Australia in an Innovative and Systematic Approach to Community Involvement in Genomic Research. Keri, what have I got? So Keri Finlay is the Involve Australia Coordinator for the Australian Genomics. Keri has trained as a genetic counsellor and has 15 years experience in several facets of genomic research and patient support and advocacy. Anne McKenzie has been a consumer advocate for 3 decades. From 2004 to 2021, Anne worked at the University of Western Australia and Telethon Kids Institute to increase the community's voice in research. I'll hand over to both of you. I can see your slides are up and ready. Thank you.
And you can see the right slide. That's,
yeah,
all looks fine. Fabulous. Thank you. Thanks so much for that introduction. As Natasha mentioned, I'm the project coordinator for Involve Australia, and I have with me today the wonderful Anne McKenzie, who is a member of our working group for Involve Australia. And so today we're going to talk a little bit about our experience developing the Involve Australia guidelines for community involvement in genomic research, and also touch on towards the end on what we see as a role for HREC in community involvement. Okay. I'd like to begin with an acknowledgement of country and echo the acknowledgements of the other speakers. I live and work in Naarm on the lands of the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today. So as a quick overview of what we're going to discuss today, we're going to talk a little bit about Involve Australia and what that is. I'll then move on to talk about developing the guidelines and how we went about that, and then delve into the guidelines in a bit more detail and talk about some of the recommendations made within that. And then we'll move on to talk about a possible role for HRECs in community involvement. So I'll hand over to Anne, who will kick us off.
Thanks very much, Keri. I'm Anne McKenzie, and I'm coming to you from Perth in Western Australia on the land of the Noongar Nation here, and I pay my respects as well. So Involve Australia has been a community-led project coordinated by Australian Genomics, as it said, and it was modelled on the former Involve program that was set up in the UK by originally the National Health Service and then taken over by the National Institute for Health Research. And that's been, you know, a guiding thing for me here in Western Australia. And then it certainly came about because of networks across the country from those working in the genomic space. And our aim has always been to promote meaningful community involvement in genomic research. And so the thing about that is to not only to be meaningful, but for it to be effective as well. And we undertook a whole range of activities, but the key informant interviews, community members clearly stated what we were trying to change when it comes to consumer and community involvement. And you can read there one of the comments that we had. You know, someone's just been approached, they want something signed tomorrow, and then you never hear anything again. And while we've heard some great practice examples already, unfortunately, there's still a lot of those. So in the context of health research ethics committees, they, of course, have the greatest oversight over what projects are occurring. And they already have consumers and community in mind when they're assessing applications. Everyone wants to do what is right, but nobody seems to be 100% sure about how to go about that. So that's why this project thought the guidelines would aim to bridge that gap. And we think this is really important for ethics committees to be aware of. Thanks, Keri. The work has been led by an expert working group, and the project leads are Monica Ferry, who is the CEO of the Genetic Support Network of Victoria, myself from Western Australia, and Sean Murray, who is the CEO of the Mito Foundation. And then there's a working group with Tiff Bowwood, John Cannings, Jack Nunn, Greg Pratt, and Fiona Rasso. So we're a mixed bunch, and we're from across the country, and we're led very well by Keri and Isabella, who are actually the people who do the work on the ground. So I think the working group started in 2021, and we met basically monthly since then. And particularly, we came together a couple of times in person. You can see by that photo there of us there in cold Victoria. And but otherwise, we met virtually throughout the time. And a lot of work was done on, you know, giving advice and input into data collection and data collection methods, data analysis, because there are researchers as part of the working group, and they were able to take on some of that work and support Keri and Isabella. And then, you know, the writing for publications, etc. So, and in keeping with good practice for involvement activities from 2022, all the community members on the working group were offered payment for their contributions to this project. Thanks, Keri.
Okay, so I will now walk through the development of the guidelines. So the guidelines were a key outcome of the Involve Australia project. And they really aimed to provide genomic researchers in Australia with information for how to involve community members effectively and meaningfully in their projects. And I think we aim this at genomic researchers, one, because this is where, you know, Australian Genomics expertise is, but also because genomics is relatively new in the clinical field, and it's constantly evolving, which means that researchers have quite a unique opportunity and responsibility to shift their thinking on community involvement, and can really make a significant difference to how community members are involved in this type of research. As shown on the previous slide, we had 10 working group members, and they attended 26 working group meetings over the 2.5 years. And we took quite an academic approach when it came to developing these guidelines. So we started with a health perception survey, which aimed to get an understanding of how the general public perceive health research involvement. So we enlisted a market research company to carry this out, and they obtained 1,200 responses for us. And so we asked participants things like, have they been involved in health research as a community member on a particular project, or have they been involved as participants? We also looked at what factors would encourage or discourage people from being involved as well. We then moved on to carrying out 14 key informant interviews with community members that have been involved in research projects, community involvement coordinators, researchers that had worked with community members, and institute leads. And I think these interviews probably gave us the greatest insights into what the barriers and the enablers were for researchers and community members. We then conducted a scoping review of existing community involvement guidelines. We wanted to identify if community members were involved in their development, and if they were involved, how. And we also wanted to look at what were they telling researchers they needed to do if they wanted to involve community. We also looked at peer-reviewed literature, looking at community involvement in current genomic research. So once we'd pulled all that information together, we drafted the guidelines and we released them for public consultation. We had 33 completed responses through a survey, and then we had 3 written responses as well. The largest group of responders were genomic researchers, followed by patients or community members. And overall, there was a really positive response. However, we also received quite a significant amount of really useful feedback that really helped refine the final version of the guidelines. So in the end, we ended up with 17 recommendations that fell across 5 domains: building relationships, setting expectations, valuing community members, evaluating and reporting on community involvement processes, and translation. And we also sought out endorsement from research organisations and patient support groups once we had finalised the guidelines. And we're really proud of how many organisations have supported this work so far. So just to delve quickly into some of the topics. So building relationships really focused on creating long-term partnerships that are founded on respect and foster trust. Setting expectations focused on setting these expectations with stakeholder perspective, all stakeholder perspectives in mind, and making sure this was done early in the project so everyone was on the same page. I think valuing community members is probably one of the most important ones, and this talks about things like offering payment, acknowledging community members through presentations, websites, annual reports as well. Evaluating and reporting talks about the importance of building an evidence base to allow others to learn from our experiences, to learn what works and what didn't work, and provide evidence that on why these partnerships are impactful. And then the last one is talks about sharing your research findings with communities. So research can directly benefit and meet community needs as well. All right, I'll quickly hand over to Anne to talk about the role for HRECs.
Okay, so look, whilst we didn't specifically look at ethics committees when we were developing these guidelines, we did note that they're rarely mentioned in as stakeholders when people are developing guidelines, and we think this is probably a huge gap. And within research, the role of the HREC was discussed on a few occasions in meetings and interviews. So we do acknowledge that ethics committees are already under a big pressure when they've got to get stuff in and out very quickly, and they've got a lot of legal responsibilities and organisational responsibilities. But we feel that the siloed approach between ethics and consumer and community involvement or engagement or whatever it is that you choose to call it, is not working in the best interest of having the consumer community voice in all research. So we feel that there is scope for community reviewers within ethics committees looking specifically at involvement activities, and then guiding researchers to tools and resources, training opportunities, if there is no involvement already talked about in their application. So we really feel that that is something that is missing. And, talking to you here today raises that as something, for example, the national statement on ethical conduct in research put out by the National Health and Medical Research Council is very, very quiet. It's not silent, but it's very quiet about the role of consumer and community involvement. And, perhaps that's somewhere where these guidelines can have an influence in the work that ethics committees do. Thank you. Back to you, Keri.
And this is just our acknowledgement slide. And if you'd like to view the guidelines, we have a QR code there as well. Thank you.